You've got the volumizers and you've got the biostimulators. The volumizers, like hyaluronic acid, it gives fills. It goes into a space that is not there and creates a little bit of filling in order to push up the area. Biostimulators, it pretty much induces collagen. The cool thing about Ellanse, it has a bit of both. So it does stimulate collagen and it fills. So you've got double action of it. It starts off by filling, and then with time you end up with collagen stimulation. You could place it pretty much anywhere, except tear trough, lips. Those are and the glabella. Those are the few areas that we would not like to inject it, especially in the glabella, because of the danger of that zone and the complications that could happen with that. It comes in two boxes, S and M. S stays for 1 year, M stays for 2 years. There's no difference between the consistency of the Ellanse itself. The difference between are the chains inside the polycaprolactone. Some chains are longer, therefore which is M, which stays for 2 years. Others are shorter, which goes in 1 year. Now here's the process. Here's exactly what happens. It starts off, you inject it, you get the volumizing effect. Slowly, the carboxymethyl cellulose starts going less. And that is what caused the collagen stimulation. That usually happens within the 6 weeks notice. So in 6 weeks, sometimes you might end up with a little dip in the volume. But if that does happen, and a patient pops back in asking to refill again, hold your fire, give it another week, and you'll find that the volume is going back to where it was supposed to be. So you end up with, the first one, you end up with the immediate restoration of the volume. And then later on, where the volume stays, that's when the magic starts happening, because you end up with the collagen stimulation. So it's like a little flower that's slowly blooming and getting better and better and better. You got the volumizing, and then the skin texture starts improving, and you see it straight away. The collagen that it stimulates is collagen type 1 and type 3. One is for regeneration, and the other one is for protection. And what happens is when it's inserted, we speak about this with Francesco just earlier, the sphere itself absorbs water, and that starts stimulating the collagen. Slowly, in phase 2, it breaks down. Once it breaks down, the volume of the spheres goes, but that doesn't mean that the volume of the Ellanse or your result go away. So this is pretty much the process of it. And if I am to address the elephant in the room when it comes to Ellanse, unlike hyaluronic acid, it doesn't have that on books. It doesn't have that antidote for it. So who is the best people for Ellanse? People who are sensible. A patient who comes in asking for 10 mils of fillers in their face straight away, and they want to look different straight away, those are not the best patients for Ellanse. Ellanse is more or less recommended for patients who want a natural look, volumization, and rejuvenation at the same time. It has been on the market for quite a long time. Francesco has been, how long have you been using it now?
12 years.
12 years. Whenever we all study evidence-based medicine, and there has been a lot of research that has been published about the safety of Ellanse and how Ellanse should be injected. And accordingly guidelines were made. And if you are to take from me one information today about Ellanse, stick to a simple number, 0.2. If you stick to 0.2 mil when you inject, you won't end up with the complications that we are all worried about, which is nodules. Inject more than that, you might end up with a bit of complications. So there's something called the dilemma. Whenever a complication happens, the first thing, the patient's going to blame the doctor. First thing. Doctor goes and blames the pharmaceutical company or the product. The pharmaceutical company, because they're polite, what they usually do is blames the patient, saying, well, it's not the right patient, anatomical differentiation. But in all honesty, 99% of the complications that you see is because of the doctor's technique. And 99% is because of rapid injection. So as long as you control the pressure when you're injecting, you should be fine. Inject it in the right level with small amounts. I know sometimes in certain areas, for example, in the jawline, if we want to inject 0.5, 0.8. That doesn't mean you can't use Ellanse, you can. It just means that do not place the whole amount in one area. Split it around. Different layers, different levels, different techniques. And there's a really cool, the guys in St. Clair with Francesco and Franco were very much involved in this, developed those guidelines, developed those techniques. You could use a cannula. I would personally recommend using a 25 gauge cannula if you're just starting to use Ellanse. It might be a little bit harder to inject, but at least it pressures, it stops you from injecting too much in one go. The box comes with in a 27 gauge, and you could use it the way you would use the way you would inject, whether you're doing a retrograde, whether you're injecting bolus. But again, if you are to choose the bolus, stick to the 0.2. If you're using fanning or retrograde, what I would usually say is for each 1 centimeter of that thread you are placing, place 0.1. So if you're doing a fanning retrograde of 3 centimeters, just place 0.3 in 0.1, 0.1, 0.1. So this is pretty much how you would avoid the complications. Pressure is the most important part. Slowly. Inject very, very slowly. Control the plunger. Because adding too much pressure, well, one, you might end up ending up with more than 0.2 mils. Two, remember always, whatever we're doing, your filler is going into an area that does not exist. If you start giving it a lot, your filler might end up in areas with the least resistance. So it might end up going to a place to a layer, to an area that you don't want it to go. So it's all about injecting very, very, very slowly. If Franco calls it the Ferrari of the fillers, because it is a fantastic filler. It's quite advanced. If you drive a Ferrari and crash into a wall, that's not because the Ferrari is a bad car, it's because you're a bad driver.
You got the wall in the wrong place.
Yeah. So same what happened. If you stick to those simple guidelines that they've done, I assure you the chances of complications is going to be very, very low. Make sure you massage it afterwards. I would prefer you massaging it. Don't ask your patients to do it. I send my patients with the least homework as possible, because some of them could be too thorough in massaging it. Make sure you're injecting it in the right layer, and this layer is the best layer is level 2 and level 4. At one point we thought the more superficially injected, the better collagen stimulation you would get. Last year we were with our late Dr. Pierre Nicolas, who I've learned from him. He's no longer with us, unfortunately, but I've learned from him that fibroblast is on every level, and you will get collagen stimulation even if you inject it supraperiostally. But we would recommend level 2 and 4 more than any of the other levels. This is a patient who had Ellanse S, one of Francesco's patients, who had Ellanse. Look at the benchmark. Look at 1 year and a half afterwards. 1 year and a half afterwards, the Ellanse has completely gone, but the skin quality has very much improved. There's a fantastic guidebook. When you get Ellanse, there's a really cool guidebook that will tell you about anatomy, about aging, but more importantly, it will tell you about the different techniques. If you speak to your distributors or the St. Clair scientific office in your country, they'll be more than happy to provide it. An application has been developed for this as well, hasn't it, Francesco?
Yeah.
There's and not only that, and it is present online. So it basically just tells you the best technique and what the company recommends in doing it. Here's another case, for example. The chin is really cool when you do Ellanse, because the difference between hyaluronic acid and Ellanse, if I want to do a chin with hyaluronic acid, I'll be comfortable to place 0.4, 0.5 mils of the product straight on supraperiostally. This is not something you would do with Ellanse, but you could still place 0.5, but in different areas, whether you choose to do it in a fanning technique or whether you want to use needles. Here's a gentleman who had 3 mils of Ellanse, how he looked before, 4 months later, by using the right guidelines. Again, another patient of Francesco. practice. It could be placed pretty much anywhere. My personal preference is the mid face because it gives you that nice collagen stimulation, it gives you that nice lifting as well following the procedure, and the best results you'll see 3 months down the line. So this is another patient, 18 months down the line, the improvement in her skin quality after using Ellanse S. Different guidelines, different ways. When it comes to complications, research has been done with regards to complications, and you can see at a 0.0277% rate of nodules formation, that's quite a decent complication rate when it's been done and used the right way. So, the secret of a successful treatment when it comes to Ellanse, make sure you place it in the right place, you use the right filler, but for the right patient. And by the right patient, I mean good patients who want improved skin quality, realistic, natural looks. How can you benefit from your practice? Absolutely, you can benefit from it because it's something you're adding to your. Not every practice, not every clinic has not every injector is using it. So it will make you shine. It will differentiate you from other practices and doctors present on the market. Stays for a long time, improves the skin quality. The disadvantage of it is non-resorbable, but that doesn't mean that it should scare you, because if you place it in little amounts, you won't have to dissolve it or resorb it. If you are a patient, if you are a doctor who uses hyaluronidase very often in your clinic, I don't think Ellanse is your best option. But if you, to be honest, in my practice throughout the years, I used hyaluronidase, I think 5 times or 6 times. So patients who come in that you know are regulars who want 5 mils and then they come in five months down the line, not happy with their fillers and the fashion statement has changed and they want something else going on, definitely Ellanse is not for them. It's more for realistic patients who want a nice natural look with biostimulation as well. The guidebook is available with online and is available in your areas. Don't be shy to ask your scientific office to get it. And that's pretty much it. We've got a few workshops to show you how to inject Ellanse, and you guys could get your hands on as well. Any questions? Yeah?
Thank you for a good speech. I want to have just one question. If you can use orbital part Ellanse.
Orbital tear trough, do you mean?
Yes.
I would advise against the tear trough. You could place it in the mid face, but I wouldn't place it at the tear trough.
But it's quite simple. Which kind of hyaluronic acid do you use in your practice? Which brand?
Which brand?
Luiderm, Still
Okay, sure. You put Voluma in the tear trough?
No, so much.
No, Voluma you cannot put it in the
No.
tear trough because it's a volumizer. Ellanse is a volumizer. You put a volumizer in the tear trough? No. This is the answer. You must understand, it's not a skin booster, it's not a stimulator. If you think about this, it means that, because I saw you arrived late, so you didn't see the first part of the presentation. In the first part of the presentation, he said that you have a microsphere of polycaprolactam inside a gel carrier that is carboxymethyl cellulose, but it's a volumizer, a strong volumizer. So you don't put a very strong volumizer in a space where the subcutaneous tissue doesn't exist. Because in the tear trough, you can use only 3 products on the market. I don't say the name. One is Precise, and we have other 2 products that you can use. I don't say which one is better, but by the way, you cannot use any other product. just to be clear.
I think, honestly, when it comes to tear trough, we have to talk about what is a tear trough. Okay? And a tear trough is not a skin problem. It's an atrophy of the bone, atrophy of the soot that creates a tear trough. So, depends how you want to correct it. If you want to correct it properly, you should go to overcome that atrophy or volume loss on the deep layers. So you go superperiosteal. If you go superperiosteal, you're safe. And with Ellanse, you are safe there. But you are using to treat the SUF. Treat the SUF and the tear trough is corrected. If you want to go subcutaneous with any product, you're going to find more or less, sooner or later, a problem, unless it's something that gives you very little volume. That's where the advantage of hyaluronic acid comes into place. But be careful, then you got the tindle effects, you got the discoloration,
Yeah,
you got all that.
Because what I find with Ellanse, in certain areas where it's very sensitive to the thickness and the amount that elevation we're going to get, we cannot predict exactly how much Ellanse is going to change in 3 months. So in the tear trough area, and correct me if I'm wrong, in the tear trough area, because it's a very thin area, in 3 months or 4 months down the line, if it starts going bigger, well, I can't do anything about it.
No, Rami, this is not. I wish that the volume increase in 2 or 3 months would be so significant. It's not. If you place 0.1 there, you got 20%, it's 0.02. It's nothing. You're not going to see anything if you put. So it's a very, very little quantities that you can say. But the truth is, in areas where you have soft tissue deficiency for some reason, tear trough, pre-jowl, noses, you have to be more careful. More careful with everything you can use. It's not just with Ellanse, it's everything. And again, is with the product that you're starting to use, you have to build experience. And when you build experience, you don't. When you take your driver's license, you're not going to the races immediately. Now you need to build up experience. The same thing happens here. Ellanse is a product for experienced injectors. Someone already has experience with hyaluronic acid or other products. And slowly you start using. The first time I used Ellanse, I didn't went to the tear trough, I didn't went to the periorbital area, I went to the mid-face, jawline, chin and cheeks. Because this is what...
But Francisco, please, but tear trough, no. SUF, yes, when you are experienced. Tear trough, no, please, because I manage all the complications, and the last 5 complications I had to manage were injection with the tear trough. After, I don't know what to tell you, if not that you made a mistake. So please don't do it. Okay.
When it comes to
No
this,
discussion.
to manage of complications,
Yeah.
I can't tell you because all of them come to both of us. 99.9% is a technical problem. Too much product in the wrong place. Or doctors get creative because they want to put their name or their brands into some treatments. And they change the products. They start adding water, they start adding this, they mix with PRP, they mix with this and that, because it's their own technique and their own product. And they don't control what they're doing anymore.
Yeah.
So,
First copy, then invent.
first thing is, we are
Please.
physicians. Our first obligation is to defend the patients and not to maltreat, not to treat them badly. And this is valid for anything. And as Rami showed, there are so many indications, so many places you can put it. So why go into the most difficult ones in the first place? Build experience, bring it up. That's why the workshops and hands-on are quite useful.
But don't think that tear trough is difficult. Tear trough is forbidden. No, really, because if you have a problem in the tear trough, we say it's forbidden. If the patient wants to denounce you, you cannot be protected because you did something that is forbidden.
Absolutely.
Just to be clear, become not a complication, but become malpractice. And with malpractice, in my country, you pay.
Not just in your country.
I don't know the country, but
Moving on, so for every tear trough patient you don't refer to Franco. Any other questions? Yes.
Thank you very much. Next, maybe a little bit tricky.
Oh, neck. I would expect.
Neck. What's the indication? You're trying when you're doing neck. The indication here is by simulation only, not the volumization, right? Do you want to, Franco?
As already I told you, the stimulation is a consequence of the collagen stimulation, but the collagen stimulation created the volume. It's not a skin booster. Don't do confusion. Do you put volume in the neck? No. Why you put Ellanse in the neck that is a volumizer? The collagen stimulation, the improvement of the quality of the skin, is a consequence, but not the goal. The goal is the volume. The goal is a filler. The name is filler, to fill, filler. Not skin booster. So, no, you don't overdilute, because if you overdilute, what happens? The microspheres, they go away. If you are lucky, you have a lot of lump and bump because they go around. No. You must follow the rules very strictly. If you do this, you have an incredible filler. If you don't do this, you are referred to me and Francisco for the complications.
Don't compare it with other biostimulators in the market that has different guidelines about dilution. Let's leave it there.
Completely agree.
I'm going to push there a little bit more. Because when it comes to neck, the neck is still, thanks God for surgeries, still a very surgical field. Because there's nothing really that works on neck for the skin laxity. Why? Because it's a very functional area, the skin is thin, you got the very active muscle that is adherent to the skin, and it's difficult to get it there. So when you want to have biostimulation in the neck, energy devices are much more efficient, because you can spread that energy to get what you want. Fillers, Ellanse, any volumizer, it's difficult to spread. So that's why people become inventive and they start adding water to those things. But there are products in the market that are water-based already. So why going to use something that is not water-based to create it water-based, which you'll never be able to spread properly? Use the other ones. We have a toolbox with several tools. You cannot use the same screwdriver for every screws. People who are starting with neurotoxin, they want to treat everything with neurotoxin. You see that? Everyone who's starting with filler, they have to do it with the filler. Combine it. That's why we have fillers, we have neurotoxins, we have threads, we have energy devices, and also we have surgery. Okay?
It's like if you want to go to fight a ship with a tank. You don't go in the water with a tank. So use the right indications.
Can I say one question again? Sorry. I use in our clinic your production. It's very good. I know you have SML production.
SM.
Yeah.
Stop.
You haven't. Yes. It continue 1 year, 1.5 and 2 years. The result.
1 and 2.
All production S 1 year and M 1.5. Can you say me the difference of radius? Radius work 8 months. I know. All now the radius. The result from.
Unfortunately, I don't think we can compare products today. It's politically.
I got to explain personally.
I think just a doctor that use all production.
Yeah,
yes.
If you no, I will be polite and not. You are speaking about two different people, two different persons, two different mechanisms of action. So the mechanism of action, I speak about the mechanism of action of Ellanse. Ellanse is a mechanical. You have the microspheres, they enter in the tissue, they stretch the fibroblasts, and you have collagen production. The bone is different. Just create an inflammatory reaction. It's totally different. It's like to speak about HA filler and Ellanse. It's completely different. But a big mistake in the past is that people, because you know, the doctors are very strange animals. We have two big problems. One, we are very proud, so we are not humble. The second, we are very lazy. Okay, there is a new product. The new products create a collagen stimulation. There is another one. Radius collagen stimulation. So I try to compare. Lazy. Go deep in the knowledge. Completely different. Mechanism of action different. No inflammation. Just mechanical stimulation. Completely different kind of absorption. Not destroying in an inflammatory reaction, but hydrolysis. CO2 and water. Completely different. This is why we can module. The product is exactly the same, the microspheres are the same, the CMC gel is the same. The only difference is that the length of the chain inside the microspheres is longer for the 2 years, but it's the same product. So we can module 1 year and 2 years, not 1 year and a half. 1 year and 2 years.
Franco, can I just jump? Because I need to go for the hands-on. Thing is, when you talk about Ellanse in terms of duration, you have 2 durations. That's like any product. When you have hyaluronic acid, and you are free to talk about hyaluronic acid because Rami yesterday showed a very good hyaluronic acid results with Miley. The thing is this, the manufacturer says the filler lasts this amount of time. But usually the result doesn't last the same amount of time as the filler. With Ellanse, is the opposite. The results last longer than the filler. So when we have 18 months or 24 months, is the period of biostimulation, because once the product goes, there's no more collagen stimulation. But the collagen is long lasting, it stays. So that's why you can show results here, 1.5 years, and only see if that result is 1.5 years, it's not going to disappear overnight. It's going to stay there for another 6, 8, 10 months. So that's why when you use Ellanse, and that's why the last part of the presentation that Rami was giving is, you need, the disadvantage of it is you need to have a learning curve, because you need to get used to it to see how much you can get it, because it's going to last long. It's totally resorbable. It's not a permanent filler, but it's a long-lasting one. So the results, good or bad, will last long. So you have to know what you do. Okay? So let's do no workshops before.
Thank you very much.
Thank you very